Certified Community Behavioral Health Clinics, also known as CCBHCs, are designed to provide a comprehensive range of mental health and substance use disorder services. House Bill 2208 was passed in Kansas in April of 2021 that impacts the way Kansas responds to the mental health and substance abuse crisis in the state. Kansas led the charge by being the first state to pass legislation to implement the CCBHC model statewide without being a demonstration state or receiving federal funds. This is the biggest change for mental health in Kansas since the Kansas Mental Health Reform Act of 1990. That's over 30 years ago. What does this mean for Kansas, you might ask? Citizens will be able to receive whole person care under one roof or through close partnerships. Kansas currently has 6 CCBHCs that were certified on May 1st, 2022. 3 CMHCs were certified as a CCBHC on July 1st, 2022. An additional 9 CMHCs will be certified as a CCBHC by July 2023, and by July 2024, Kansas's goal is to have all 26 CMHCs certified as a CCBHC. According to the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, 1 in 5 people in the United States has a mental illness or an addiction. In Kansas, during the period of 2017 to 2019, the annual average occurrence of individuals with serious mental illness was 6.1%. That's higher than the national average of 4.8%, according to SAMHSA. During that same period, the annual average occurrence of past year mental health service use among those with any mental illness in Kansas was 49.5%. That's higher than the national average of 43.6%. And lastly, during the period of 2017 to 2019, the annual average occurrence of past year substance use disorder in Kansas was 6.8%. Similar to the national average of 7.4%. What the data showed is that there is a need to improve the behavioral health of citizens in Kansas, and with the CCBHC model, we're hoping to expand services, reach more individuals, and provide whole person care. CCBHCs have 6 criteria to meet to provide high quality care. Those criteria are staffing, availability and accessibility of services, care coordination, scope of services, quality and other reporting, organizational authority, governance, and accreditation. One of the most significant changes in the service delivery model for CCBHCs is care coordination for everyone. Care coordination is the linchpin, the cornerstone of CCBHC. What does care coordination look like at a CCBHC? When an individual walks into a CCBHC, the individual is screened for behavioral health at the beginning of an appointment, and a full spectrum of services from primary to specialized care is provided under a single roof or is contracted through close partnerships. Here's an example of what it can be like to receive services at a CCBHC. This is Sarah. Sarah struggles with depression and turns to alcohol to help cope with her issues. Sarah told her friend that she was struggling with depression and didn't know what to do. The friend recommended to Sarah that she go seek help at the Certified Community Behavioral Health Clinic. The next day, Sarah's friend took her to the CCBHC to go schedule an appointment. Sarah was seen the same day where her behavioral health issues were addressed, as well as her mental and physical health issues. The CCBHC set up ongoing services to treat Sarah's mental and behavioral health. The CCBHC scheduled an appointment with a primary care physician to help treat her physical health further. Because Sarah's driver's license was suspended, a peer support specialist transported Sarah to her doctor appointment. The CCBHC followed up with the primary care doctor afterwards. Sarah was transported to and from the CCBHC every week for services. After 6 months of nonstop treatment and support, Sarah was stable and no longer drinking alcohol. the CCBHC remained in contact with Sarah on a consistent basis to check in, see if there was anything she needed, and to make sure she didn't relapse. Attention, citizens of Kansas. Be inspired and empowered to break the stigma. Go seek help if you need it. Spread the word to your family, friends, colleagues, students, and loved ones that Kansas is expanding the way we take care of our health. The COVID-19 pandemic was a devastating time, and since then, mental health issues have been on the rise. And we know that our mental health affects our physical and behavioral health too. And for providers, this is a great opportunity to be innovative. CCBHCs are breaking down silos and are all-inclusive. CCBHCs provide person-centered and family-centered care for consumers because they are the experts of their own lives. They just need help managing it, and that cannot be done without focusing on the whole health of the individual. That's where care coordination comes into play. That means forming relationships and agreements with other providers such as hospitals, the police department, nursing facilities. The list goes on and on. If you have any questions regarding CCBHC, please feel free to reach out to us or visit our website for more information. Thank you.